Hi, Mrs. Jones.
Hi.
My name is Kelly. I'm from Occupational Therapy. Your doctor ordered an OT eval today due to some symptoms you're having. I would just like to ask you do you know what occupational therapy is?
No.
Okay. So we're here to help you get back to doing your activities of daily living. So dressing, getting ready in the morning, taking care of things at home, things like that.
Okay.
So, I can see from your chart that you suffered a right CVA, so this caused some of your left hemiparesis or like loss of feeling that you're having. So this happened about a week ago. What's your pain level right now from 0 to 10?
Like a 5.
Okay, 5. So and I also see that you have some sternal precautions. So what this means is that we don't want to be reaching overhead for things. We don't want to be putting too much pressure through your arms when we're getting up. We don't want to be carrying heavy things, which we're not going to do so much right now with you. And I see that you're also on the nectar liquids here. How's that going?
It's terrible.
Yeah. So hopefully we can wean you off of that as soon as possible. And I also see that you have some orthostatic hypotension, so we just want to make sure that when we get up, we're doing it slow, so you don't get dizzy or anything. And if you ever do, just let me or anyone know so we could sit you back down. And I also see that you live with your husband. Do you have any small pets or anything?
Yeah, I have a dog.
Okay. And in your condo, is there any stairs to get into the place?
Yeah, there's 3 steps to get in.
Okay. And do they have railings?
Yeah.
Both sides?
Mm-hmm.
Okay. And in your bathroom, is it a step-in shower? Is there a tub?
There's a tub.
Okay. So you have to step over?
Mm-hmm.
Okay. Are there any grab bars or anything?
There's a couple of bars.
Okay. Are they metal?
Yeah.
Oh, perfect. And do you have any adaptive equipment at home, like a walker, wheelchair?
No.
Okay. So, and no history of falls, correct?
Correct.
Okay. So I'm just going to ask you a few questions just to see where you're at cognitively. So, do you know what day it is?
December 12th.
Okay.
2015.
Do you know who our current president is?
Obama.
Yeah. Okay. And what do you like to do, Mrs. Jones, in your free time?
I like to cook and build model airplanes.
Cool. Can you tell me the steps for building a model airplane?
You get the body of the airplane, you glue on the wings and the back, and make a propeller. You have to sand it, and then paint it, and polish it,
Okay.
and then you fly it.
Great. So it seems like you have some memory of that, some steps to do things. And do you wear glasses, Mrs. Jones?
No.
Okay. So I'm just going to have you just follow my finger just with your eyes. Okay, great. So what I'm going to do now is we're just going to slowly sit you up, and then we're going to sit on the side of the bed. I'm just going to have you perform a few things for me, and then we'll lay you back down.
Okay.
Does that sound okay?
Mm-hmm.
Okay. I'm just going to lower you a little bit. Okay, just be careful. You feeling okay?
Uh-huh.
Okay, just going to bring the legs over. Awesome. Okay, you feeling okay still?
Uh-huh.
Okay, so what I'm going to do is I'm first just going to ask you to see how you take off your shoes. Okay, and can you put them back on for me? Sorry.
Try.
great. So I see we need to work on the use of your left hand. So can you show me how you would brush your teeth and wash your face? I want to see both. Okay. So we got some motion over there. The right looks good. And then I'm just gonna do a quick manual muscle test on your right arm. So can you bring it up like this and back down? Bring it back up. I just want you to hold it and don't let me move you. Okay, so you have some pretty good strength on the right side. Now can you bring the left arm up? And back down. Okay, I'm just not gonna test the strength for now. Okay. Let me see where I'm at. Okay, Mrs. Jones, what would you like to get out of occupational therapy?
Just to be able to use my left side more.
Okay, to
So I
do
can cook
things you
and-
love.
Yeah.
Okay, so I'm just gonna show you one little activity that you can do while I'm not in the room and when you're watching TV and everything. I'm just gonna bring this table over. So what I'm gonna have you do with your left hand is you're just gonna scrunch it up so you can get the use of your fingers back, and you're just gonna scrunch it back out. So can I see you do that for me? Good. And how does that feel?
It hurts a little.
Okay. And then what you can also do to get some range of motion back is pretend to clean the table. And if you need to use your right arm just to bring your left arm over, you could do that too. And I'm going to tell your nurses to make sure that they leave a towel in here all the time on your breakfast tray and stuff, just so we can get the use of it back.
Okay.
So I'm just going to lay you back down, and we're going to talk about some goals.
Okay.
So we're just going to bring your legs up. Good. You feeling okay? So just some goals we could talk about for you is, so the towel is going to help with your hand function, just to get that manipulation back due to the stroke, so you can just get dressed better, like putting on your shoes. It'll help you with cooking and building your model airplanes. We're also going to work on your endurance, so that you can walk your dog and get around the house without getting shortness of breath, which I saw you have on your chart too. And then we're also going to work on some balance, because you have a walk-in tub, you have 3 stairs coming into your house, so it's really important that you don't have any falls. So what I'm going to recommend for you is we're gonna have a wheelchair in here for you, just so we can get you transferring, get you from point A to point B. It's also good to have you out of bed as much as possible, because we don't want you just laying here all day, and getting you out of bed will help build up your endurance. I'm also going to recommend a shower chair for your tub, so it just goes over the tub and you just slide right in. You said you have grab bars, and there was something else I wanted to recommend. I think we should probably get a walker for when you're home.
Okay.
And then, shoot, I lost my train of thought. I'm also going to recommend for PT to see you, and then I'm going to recommend after we're done in this setting that you go to an inpatient rehab so they can be more aggressive with you, just to get you back to where you want to be, because you seem very motivated, you seem like you have a good life at home, so we want you to get back there doing things you love and doing them safely.
Okay.
So do you have any questions for me? No? All right, and I look forward to working with you.
Thank